This video is brought to you by TrueLearn Question Bank. Use the link in the description box to get a discount to your subscription. What is going on, everybody? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my Vignettes playlist. In previous videos, we had cases about biochemistry, cardiology, pulmonology, nephrology, and today there are more physiology and cardiology cases. So click the like button, click the subscribe button, and let's get started. TrueLearn is a question bank with thousands of cases with answers and explanations, of course. Many of them have summary tables embedded within the explanations to help you understand more. TrueLearn integrates with Picmonic so that you have pictured mnemonics in the explanation after the question. To get a discount, click on my link in the description box. It's also in the first comment. We have many cases today, so please bring a piece of paper and let's see how many of these cases you can answer yourself. Let's go. And here's the first case. We have a 72-year-old man coming to the emergency department following a near syncopal event. He was putting dishes away when he began to feel lightheaded and needed to sit down. For the past 3 weeks, he has had multiple similar episodes. He has a history of coronary artery disease and hypertension. His temperature is 36.2 Celsius, 97.3 Fahrenheit, and blood pressure of 100/62 millimeters of mercury. Physical examination shows clear breath sounds on both lungs. There are no murmurs, no gallops heard during cardiac auscultation. The neck veins are non-distended. An EKG was done and the results are shown here. The question is, which of the following answer sets represent the most likely cause of this patient's symptom and the most appropriate long-term management? Is it A, Mobitz 1 and you should observe, or is it Mobitz 1 and you should place a pacemaker? Or is it third-degree AV block and the patient needs a pacemaker? Is it Mobitz 2 and the patient needs a pacemaker? Or is it first-degree atrioventricular block and the patient needs atropine? Please pause and try to answer this yourself. So what should I do first? Well, we have syncope here, so keep that in mind. Whenever both lungs are clear, we can tell that the left side of the heart is relatively okay. I mean without myocardial infarction or heart failure on the left side. Next, whenever the neck veins are not distended, you can argue that the right side of the heart is relatively okay, meaning without myocardial infarction or heart failure. And then there's the EKG. What's the first thing that we should do? We should calculate the rate of this heart. Okay, let's count the number of big boxes between this R interval and the following R interval. So here is one big box, 2, 3, 4, 5, 6. And I have one half here and half a big box here. So let's call it 7. So you use the 300 rule. It's 300 divided by the number of big boxes between this R interval and the following R interval, which becomes 7. 300 divided by 7 is what? It's about 43. Okay, 43 beats per minute. Is this bradycardia, tachycardia, or normal heart rate? The answer is, of course, this is bradycardia. What is the normal heart rate, please? Oh, it is 60 to 100. You stop it right here. It is 60 to 90. 100 is a little tacky. So this patient has bradycardia, but notice that the distance between this R and this R is not the same as between this R and this R. It's not the same between this R and this R. So this is an irregular heartbeat, or maybe we are dropping some beats. So let's call this bradycardia, all right? And then what are the causes of bradycardia? What are the different arrhythmias that can lead to bradycardia? We have sinus bradycardia, okay? We also have the atrioventricular block, also known as heart block. And we have 3 degrees. There is the first degree, second degree, and third degree AV nodal block. Okay, so let's see. Do you think this is sinus bradycardia? I don't think so, because sinus bradycardia will be slow and regular. This is slow, but slightly irregular. Also, look at the PR interval here, okay? It's about one big box. Let's look at the PR interval here. It's larger than one box. How about here? Even larger than that. So this is not sinus bradycardia. Let's try AV nodal block. We have 3 types. Mobitz 1, it's bradycardia. Everything is okay. Every beat is conducted. Every P is followed by a QRS. The only problem is that the PR interval is longer. The AV nodal conduction is slower. There is more delay, but make no mistake about it, everything will be conducted. But here I can notice a dropped beat. So this cannot be first degree AV nodal block. Let's try third degree AV nodal block. In third degree AV nodal block, there is complete dissociation between the atrium and the ventricle, which means that there will be no relation whatsoever between the P wave and the QRS, meaning the P wave could happen before the QRS, with the QRS, or after the QRS, and it's always random. But here I see that the P wave is always before the QRS. Okay, so this is not third degree AV block. Then it has to be second degree AV block. Okay, second degree AV block has two subtypes. There is Mobitz 1 and there is Mobitz 2. In Mobitz 1, the PR interval prolongs, and drops. However, in Mobitz 2, there is no prolonged drop. There is just sudden drop of beats. Here I can see there is okay, and then prolong, drop an entire beat. So this is Mobitz type 1. Okay, so it's second degree AV block, Mobitz type 1, which means I can get rid of choice E, I can get rid of choice C, I can get rid of choice D because it says Mobitz 2. So it has to be Mobitz 1. Okay, what should I do to this patient? Observe or put a pacemaker? Well, look at this. Anytime the patient starts to be symptomatic, such as syncope, we're not playing anymore. This patient requires a pacemaker. We can observe if you have sinus bradycardia and everything is hunky-dory and you're not symptomatic. But once you have symptoms of heart block, you need a pacemaker. Next, number 2, we have a researcher using pluripotent embryonic stem cell to study differentiation of cardiac muscle. She has successfully generated cardiac precursors that she further differentiates into atrioventricular nodal cells, his Purkinje cells, as well as ventricular cardiomyocytes, in order to discern which group of cells is associated with each type of cardiac tissue. She measures conduction velocity in each of the samples. Her data are shown below. Sample 1 has a conduction velocity of 1 meters per second, sample 2, 4 meters per second, number 3, 0.05 meters per second, number 4 is 2, and number 5 is 0.03. Using the data from the experiments, which sequence of experimental samples below best represents conduction of depolarization wave from the AV node to the ventricular myocytes in the normal human heart? Please pause and try to answer this yourself. So here I have 3 samples. I have a sample that has the AV nodal cells, another sample for the Purkinje cells, a third sample for the ventricular cardiomyocytes. Now, what are the speeds of conduction in each of them? In the order of conduction, which means I want the AV nodal cells first, followed by the Purkinje cells, and last we want the cardiac myocytes. In the ventricle, if you're good at physiology, you will recall that the AV nodal conduction velocity is between 0.03 and 0.05 meters per second, and that the Purkinje is the fastest, it's 4 meters per second, and the ventricular cardiac myocytes is about 1 meters per second. So I want to start with this number, followed by this number, followed by this number. So for the AV nodal conduction, well, I'm between 5 and 3. So this could be sample 5 or sample 3. I want Purkinje fibers to be 4 meters per second, so that's sample 2. And I want the ventricular cardiac myocytes to be 1 meters per second, so that's sample 1. So if I see 5, 2, and 1, or 3, 2, and 1, that will be the correct answer. Do I see 5, 2, and 1? Yes, it is there. Do I see 3, 2, and 1? I do not, so this makes choice E the correct answer. Make sure to read this case carefully because the next question is also dependent on the same facts. And here is question number 3 for you. One goal of this researcher is to develop conditions for study in the laboratory that mimic in vivo cardiac arrhythmias. The researcher is able to develop re-entry loop in tissue sample 1 that is similar to some found in humans after a myocardial infarction. Which of these arrhythmias in human patients involve a re-entry loop in the cardiac tissue that is similar to the type of tissue in sample 1? Is it A, sinus bradycardia, or B, first-degree AV block, C, third-degree heart block, D, bundle branch block, or E, ventricular tachycardia? Please pause and try to answer this yourself. The first order of business is to focus on sample 1. Sample 1 has a conduction velocity of 1 meter per second. The question is, which part of the heart is sample 1 whose conduction velocity is 1 meters per second? Is it the atrium, the ventricle, the AV node, his Purkinje system, or what? If you remember from the previous question, 1 meters per second was the ventricular cardiac myocyte. So these are muscles of the ventricle itself. Now, which of the following arrhythmias happen because of a re-entry in the ventricular cardiac myocytes? How about sinus brady? No, sinus brady is a problem in the SA node, which is not in the ventricle. And the conduction velocity in the SA node is not 1 meter per second, but 0.05 meters per second. First degree AV block, well, that's a problem in the AV node. What is the conduction velocity in the AV node? It is not 1. The conduction velocity in the AV node is about 0.05 meters per second, which makes choice B incorrect as well. How about C, third degree AV block? Well, third degree heart block is still an AV block, so the conduction velocity is 0.5 meters per second, so C is incorrect. Bundle branch block, oh, that's the problem in the bundle. It's the famous bundle of His. In the bundle branch, the speed of conduction is about 1 meters per second. However, I will not choose bundle branch for a simple reason. The arrhythmias in the bundle branch, i.e. the bundle branch block, is not a re-entry loop, because the re-entry arrhythmias could be classified into macro re-entry and micro re-entry. Macro re-entry arrhythmias include AVRT, they include atrial flutter, and they include ventricular tachycardia. As for the micro re-entry, they include AVNRT, which is not the same as AVRT. Instead of atrial flutter, this time it's atrial fibrillation. And instead of ventricular tachycardia, here we'll have atrial tachycardia. So I will not go with choice D. Let's try choice E, ventricular tachycardia. Yup, there you go. Ventricular tachycardia is a re-entry. And the speed of conduction in the ventricular myocytes is 1 meter per second, as we have discussed in the last question, making choice E the correct answer. Question number 4. A 15-month-old girl brought to the physician for evaluation of episodic cyanosis, so that's important. Her parents complained that she has difficulty keeping up with other children her age and that her face and lips turn blue during these episodes of increased exertion. Her father notes that she will sometimes assume a squatting position during these episodes and that this seems to result in improvement, so the squatting makes the cyanosis better. To a healthy 28-year-old preemie gravid woman, through uncomplicated standard vaginal delivery, her newborn course was uncomplicated and she was discharged home on day 2 of life. Since then, she has had no significant medical problems and has been kept up to date on all the recommended immunization. Her vital signs are stable, her breath sounds are clear on both sides, cardiac auscultation reveals a systolic ejection murmur at the left sternal border. A chest X-ray is ordered and it's shown below. Which of the following best explains the improvement in cyanosis that is seen when this patient assumes a squatting position? Is it A, decreased left to right shunt, B, decreased systemic vascular resistance, C, increased preload, D, increased pulmonary vascular resistance, or E, increased systemic vascular resistance? Please pause. What is this? I have cyanosis that improves when I assume the squatting position. And there is a murmur. And my heart looks like this. Well, if you are good at X-ray, you will look at this heart and say, you know what? This is a boot-shaped heart. It looks like a boot. And we have a youngster that has cyanosis that improves upon squatting. This is unequivocally tetralogy of Fallot. Let's review. Tetralogy of Fallot is called tetralogy, but it's actually one problem. Really, yeah, it's a one problem, one defect that led to 4 consequences. So here are right side and left side of the heart. The one problem is that the interventricular septum, instead of being right smack in the middle right here, has been shifted up and to the right. Something like this. Okay, now here I am shifted to this side, which is going to make the right side narrower, meaning I'll have pulmonic stenosis, and that's the first manifestation. Then, because of the pulmonic stenosis, the radius decreases. When the radius decreases, the resistance increases. And when the resistance increases, the pressure increases. So, this poor right ventricle will have to pump blood against very high pressure in the pulmonary artery. So, the right ventricle will have to enlarge in order to shoulder that stress. So we call this right ventricular hypertrophy. What do we have on the left side? We have an aorta. Oh, look at this. Because of this congenital malformation, the aorta is now facing the left ventricle as usual, and it's also facing the right ventricle. That's not normal. So we call this overriding aorta, and this is the third manifestation that we see in tetralogy of Fallot. It's called tetralogy, so what's number 4? You see here there is a gap between the right ventricle and the left ventricle because the septum is not formed properly. So there is an abnormal communication between the right ventricle and the left ventricle, and this is called ventricular septal defect, and these are the 4 manifestations of tetralogy of Fallot. So when someone says, I think this patient has tetralogy of Fallot, this is a claim that I need to be able to prove. You have tetralogy of Fallot? Prove it to me. What's the P? Pulmonic stenosis. What's the R? Right ventricular hypertrophy. What's the O? Overriding aorta. And the V is ventricular septal defect. Now the question is, why is the cyanosis improved in the squatting position? First, what causes the cyanosis in the first place? What causes the cyanosis is that blood from the right side, deoxygenated, is going to reach the aorta because it's overriding. Now all of this deoxygenated blood is going to reach my skin. Oh, so I get bluish discoloration. I get cyanosis. Why will the squatting improve the cyanosis then? Because when I squat, I want you to squat right now. Your legs are tight. So you are compressing the arteries in your legs with vengeance. This decreases the radius in those arteries in your legs, and when the radius decreases, resistance increases. When resistance goes up, pressure goes up. So now the resistance and the pressure on the left side in the systemic circulation is very high. Now, from the perspective of this right ventricle, do you think it's now easier or harder to pump this deoxygenated blood to the aorta? It became very hard to pump deoxygenated blood to the aorta because now the aorta is a high resistance system. So the right ventricle will prefer to give its blood to the pulmonary artery, which is normal. So now we are reducing the shunting to the other side by raising the systemic vascular resistance, and this is caused by the squatting, making choice E the correct answer. Next, question 5. Here is a case for you. That will be your assignment today, is to tell me the correct answer in the comments and the explanations on why you chose that answer. TrueLearn has many more interesting questions like these. In the explanations to many questions, TrueLearn will provide tables such as this one. This table summarizes Marfan syndrome. It talks about the genetic defect, highlighting the most important fact, some clinical features that you need to know. And I want someone in the comments to tell me the difference between lens dislocation and lens subluxation. And here are the complications of Marfan syndrome. TrueLearn integrates with Picmonic, so after a question on Marfan syndrome, you will see this Picmonic. I hope you can appreciate fibrillin 1 mutation, the frog with number 1. Look at this pectus excavatum, the pectus excavator. Arachnodactyly, fingers that look like a spider. Mitral valve prolapse. Here is a mitral valve with 2 cusps that has prolapsed. And here is aortic regurgitation and lens subluxation. A lens in a submarine. TrueLearn has questions for USMLE, COMLEX, PANCE for physician assistants, NCLEX for nurses, and certification and recertification exams for internal medicine doctors, OBGYN, neurology, anesthesiology, emergency medicine, and much more. TrueLearn has thousands of questions. You can sort by the degree of difficulty. They literally give you a scale from 1 to 10, 1 being the easiest questions and 10 the most brutal ones. And then you can create a block specifically and precisely at the difficulty level that you prefer. For example, you can choose level 10, and all of the questions in that block will be the most difficult. You can also create a block based on a topic, such as tuberculosis or sarcoidosis. They have summary tables such as the one on Marfan syndrome that I've just shown you, detailed analytics, and they integrate with Picmonic. Speaking of detailed analytics, they tell you how many questions you answered correctly, your percentile when compared to others. My mom would have kicked me out of the house if I have scored less than this. And as you see, I will not recommend any product for you until I've tried it myself. And it gives you a list of the topics that you made mistakes on. For example, I made a mistake on Haemophilus influenzae question. So they will show me, hey, you gotta review this topic. And as you see, my last exam was on a special topic that's influenza. So all of the 16 questions in that block was about influenza only. So if you are weak at a certain area, you can practice some more. You can try TrueLearn for free. Click on the link in the description box. They will give you a discount if you click on my link or if you use my discount code MEDICOSIS. Thank you TrueLearn for sponsoring this video. Thank you, my dear students, for watching. As always, be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.